Mental Health Monday on Radio City Talk with Mick Coyle.
Radio City Talk.
Jake Mills is back in the studio for Mental Health Extra. My name's Mick. Hello, Jake.
Hello. How are you?
I was just saying that as an introduction. Now, my name's Mick. You already know my name's Mick.
Yeah.
I was name dropping you the other day.
Yeah. I heard it.
Just a name drop you to Jeremy Corbyn.
Yeah.
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 Talking about the work that you've been doing in regard to mental health. Seeing as the Labour Party conference is in town, we're going to start with this when it comes to mental health matters.
Yeah. Did you name drop me or did you name drop the Hub of Hope?
Well, the Hub of Hope, in many ways, was more important that name got out there.
No, I was just checking.
Well, just so you know, I mentioned the actual thing that you set up, which actually provides mental health services to people right across the country, as opposed to saying Jake Mills. Because no offence, but like if I'd have gone Jake Mills, it'd have gone who? If it had Hub of Hope, it'd have gone, oh yeah, that prestigious and national and important thing that Jake Mills set up.
Yeah.
I only had a limited amount of time with him, Jake.
It's a bit of a backwards compliment that you've just given me there. I feel insulted and inspired at the same time.
It's the equivalent of me mentioning Liverpool. Now, I didn't mention Bill Shankly. Now, arguably, Liverpool were built by Bill Shankly. You know what I mean?
Yeah. I appreciate it all the same.
Okay, so he wanted the personal glory. He didn't get it. But I did have a chat with Jeremy Corbyn yesterday. We were talking about many things as part of the conversation. Of course, mental health came up on the agenda. I mentioned that, obviously, we're very passionate about it here at the station as well. It's something that has been a passion for him. We do some great work right around the region. I wanted to make sure that he knew that Liverpool was very much a mental health city.
Absolutely. I have talked to Luciana Berger about this, and I have talked to Steve Rotherham and others about this, as well as Joe Anderson. Yes, we do need more money into mental health, but we also need a change of attitude towards mental health, because a quarter of us are going to suffer a mental health crisis in our lifetime. We have to have a community approach which supports people and the resources that are there. But if somebody makes what is a significant leap of going to their doctor and saying, look, I'm suffering severe stress, I'm suffering what is a mental health condition, can you get me talking therapy? And they have to wait 6 months to get it. That's too long. Likewise, the lack of emergency bed space for people going through a total breakdown or crisis within the local community is serious as well, because you need family and friends to visit you.
That's Jeremy Corbyn speaking to me yesterday. I also caught up with the Shadow Health Secretary, John Ashworth. Now, he was in town because he was taking a look at the situation in regard to the Royal Hospital, but of course, mental health very much on the agenda. And I wanted to get his guarantee that if Labour were to win the next general election, there will be a ring-fence funding for mental health services. Let's take a listen to what John Ashworth had to say about that.
Yes, absolutely. And I know that Liverpool have a mental health festival, I think, every year. And I know that in Luciana Berger, one of your Liverpool MPs, you've got, I think, the greatest champion in Parliament for mental health initiatives. She's won lots of awards, and quite rightly so for that. And I'm a great fan of hers, and I think she's a great MP. I think mental health is mental health policy and mental health provision is the next frontier for NHS expansion. We've neglected it for years, really. And we've sort of, we've also kind of hushed it up as a society. Well, I think attitudes are now changing towards mental health conditions, but we've got to put the investment in, and it really is disgraceful that in many parts of the country, and I'm sure it's going on in Liverpool as well, although I haven't looked at the exact figures for Liverpool, but I imagine it would be going on because it happens elsewhere, is that the child and adolescent mental health budgets and the child and adolescent mental health provision, supporting some very vulnerable young people, a lot of the budgets have been cut back because of national decisions. I think that's appalling. I think we should be expanding children's and adolescent mental health services, not cutting them back.
When we have this phrase, though, parity of esteem, John, why is it, do you think, that actually, when you've spoken to people within the health service, that mental health is always seen as the second-class citizen? It obviously touches on so many things. It's obviously linked to so many different factors as well. Is it about finance, or is it about sort of the will of people and the understanding of people to make something happen on this?
Well, it's a really interesting question. I think it's for years. We always put money into the acute sector, because that's the sector which gets the most publicity, if you like. We all know when the A&E is in crisis and the ambulances are backed up outside it, and people are languishing on trolleys in A&Es. We all see those pictures on our TV screens every sort of winter, don't we? So we don't see the same sort of graphic examples on the TV screens of mental health services, do we? So perhaps that's one reason why over generations it's not had the support that it should get. But I'm saying that's going to change. We want to deliver what we call parity of esteem, and I think people now expect better provision of mental health services, because I even thinking back for sort of last 5 years, I think people talk about these issues much more now in society. People talk publicly about their own mental health issues that in a way in which people perhaps didn't even 5 years ago. So I do think attitudes are changing, and that's a good thing.
That's the Shadow Health Secretary, John Ashworth, speaking to me. He's in town for the Labour Party conference. Jay, I kind of got the sense from those two people, I don't want to get into the politics of this one, but, sometimes you get a sense politicians being a bit disingenuous with their comments. I think both of those responses suggested there was very much more that they wanted to do in regard to mental health. I mean, for the Shadow Health Secretary to describe mental health as the new frontier or the new frontier for NHS expansion gives you a sense that there's one party there very much minded to expand the provision that's out there.
Yeah, it's reassuring to hear, and I do actually think from kind of personal experience as well that particularly Jeremy Corbyn does seem to understand and care about mental health and the provision in the country. John Ashworth makes a point there, and you can't expect him to know everything, every figure and statistic from around the country, but he makes a point there about children's and adolescents, and he said he wasn't sure about in Liverpool, but we know that it is a significant problem in Liverpool, particularly with why passed last year getting a 43% budget cut from the CCG. So we know that it is a significant problem. However, with any kind of politician, I think particularly being in opposition, it's quite easy to say the right thing and to say what you would change, and it's a different story once you are in power, if you do get power, and making that vision and those words a reality. So it's nice to hear, and hopefully it's something that people will listen and take note of.
Both of those politicians, I gave credit to the Liverpool Wavertree MP Luciana Berger, noted that one as well. And also this idea of NHS expansion. Sometimes you get a sense that people are trying to find a way of doing mental health, not on the cheap, or, well, maybe on the cheap, with current systems, current funding, current spending the way that it is. But actually from John Ashworth there, he used the phrase expansion, which is basically, look, we can do more on this one. This is more of something, as opposed to finding a new way of doing something we're currently already doing.
I think that's what's important, actually. Again, I do to give credit to the current Health Secretary, Matt Hancock. He again is saying that he's taken a kind of on board that we do need to look at different innovative ways of doing it, and I think that's important because the current ways are not good enough, and they're not only not good enough, but they're getting worse, consistently worse.
I wonder whether or not, and sometimes if it's the Ministry of Health, then you can go, it's broken legs, it's cancer treatments, there is a cause and effect, if you like, that they can sort of opt into various different things for various different reasons, different focuses as well. But I can't help but think that from a mental health point of view, it's almost a bigger job than the Minister for Health. Because actually, if you think about mental health, arguably, the Education Secretary should be as well versed in mental health as sort of the Health Minister, in the same way that the Business Secretary and various other people as well. Right, there almost needs to be a separate Ministry of Mental Health, and I wonder whether or not actually that's something which needs to be looked at, that all considerations bear in mind people's mental health, because it can affect many different things, including health itself, but those matters within education, within universities, for instance, within the workplaces as well, that falls into workers' rights, a whole host of other things that goes way beyond the health sector.
Yeah, I would agree with that, really, and I think Luciana, who was mentioned, she became the first shadow minister for mental health, and she left that post, but it was carried on, and I think that I thought might have kind of sparked a similar reaction from the government. I know that it did locally, and I know Johansson made a mayoral lead for mental health specifically for that reason as well. And I do think that's right, because it does cross so many sectors, and it's such a huge kind of role and position to take on that it is its own thing. And I think as well that will help us take it a little bit more seriously and stop it from being just kind of lip service.
Thank you to everybody who has been taking part in the programme in regard to the Labour Party conference as well. Obviously, if other political parties have been on the show in the past as well, from different people.
Next week.
These basically are the people who are in town at the moment. Yeah. Just a quick mention to the other side of the country, Brighton and Hove Albion Football Club, who put a statement up on their website from Anthony Knockeart, who was a very talented French footballer who kind of emerged on the scene, then disappeared from the scene, and reveals as part of an interview that he's given to the club about the issues that he went through. I went through depression last season, which people obviously didn't know about. It was really tough and mentally impossible for me to go and perform on the pitch. I went through a divorce last year during pre-season. It was really tough to take, especially after my dad passing away. He says, I wasn't able to do what I should be able to do on the pitch. The club helped me, and now I'm ready to talk about it. I'm happy again, and everything is going well in my life, which is quite a brief summary of obviously what was a very difficult time. But there was just one element of it which I really, really like, because often we talk about, if you do speak to somebody, will they say the right thing? Mm-hmm. Now, I've always been very warm towards Chris Hughton, who has always struck me as a fairly decent fellow, a good football man, and so on and so forth. I said to Bruno last December, one of the club staff, that I couldn't keep going like this. And he went to see the gaffer. He, Chris Hughton, then sorted me out. The manager came to speak to me and said, we're not giving you the choice, we're getting you a counsellor. And I kind of saw that my heart lifted then, because although it was delivered with that, I'm your boss and you're going to get some help, it came with that thing of, I'm prepared for you to tell me this, and I now know what we're going to do, and I'm going to be the one who makes that happen. Taking responsibility for the individual there is what any good workplace should do, and Chris Hughton, to his absolute credit there, had a plan in place, was anticipating this as being a potential issue, and then has gone about making sure that happens.
Yeah, and I think it's an example that should be replicated in businesses and organisations throughout the country. It was, do you know what? A story like this 5 years ago, you'd never hear this. We've on this show, when we've done the 24-hour show, we heard from Stan Collymore, who was almost the complete opposite of this example. I just think it's brilliant, and I have to say that they're a fantastic club who are taking mental health seriously, not just with the first team players and this example, but throughout their community work as well. We've had conversations long before this story came out, and they were fantastic and really forward looking and wanting to make a difference. So it's brilliant, and again, it's another example of a high profile person who's a hero to a lot of people, saying that I've struggled and it's fine, I got help and I'm coming through it. So it'll go a long way in helping a lot of people.
Now there is another workplace related story which I'm going to skirt around because it involves a spoiler for Bodyguard.
Yeah.
Now, have you seen the final episode?
Yeah, I've watched it.
Right, so let's not say anything.
I don't care.
But this isn't going to be a spoiler. But for a TV show based around a drama, to actually physically involve somebody's manager organising a meeting with Occupational Health. John Ashworth said it as part of that. I think it's not something we've seen in TV before, but it's almost made a priority a little bit late, and after all the dramas happened, and probably after much more damage has been done to the poor fella that was necessary in the first place. But there's a point within the final episode where Occupational Health gets raised. I won't say where in the episode. And the point being, you need to sit down and speak to somebody. John Ashworth said he's not seen that happening before, but actually there was a good example from the biggest show on TV at the moment of mental health being a focus.
Again, taking responsibility and using the opportunity that you have to put it in there. I think we have come a long way. We talked earlier on in the year about Coronation Street and their line that they used and the way they handled it. I think mental health has been in the media a lot. It's been in probably every soap a million times. The difference is they're using it differently now and they're being more responsible when they're actually putting that message together and they're thinking about the actual people who are going to be watching it.
And another example, Jenna Coleman's new drama. She was on the One Show, I think, last night, talking about being a parent and talking about some of the issues that come with being a parent for the first time. That was the focus of this week's Mental Health Monday and the great work being done at the Liverpool Comedy Trust. I think what I like about the Liverpool Comedy Trust work in regard to getting mums together to talk through is they have this thing, look, you're allowed to laugh. Because often one of the things that you find yourself in as a new parent, and I've been through this twice, where you're thinking, there is literally, like, the severity of the situation, this child's life is your hand. If you do not feed them, they will die. If you do not check that they breathe, there's like if you think about it really seriously, it feels like a really serious thing. But actually, those elements where they go, actually, you're allowed to laugh at this, and it's okay. It doesn't mean you're not a suitable parent. It doesn't mean that you're going to do something wrong. But you are allowed to find comedy in this, and that actually might sort of make you think about things a little bit different, but also integrate and interact with other parents too. Yeah,
and there's always comedy in every situation. It just there's the right time for it. But the power of comedy, the best type of comedy is something that a comedian will go on stage and say something and the whole room go, oh, I do that. So what better way of kind of handling, whether it's kind of mental health problems, perinatal mental health, to be able to say, has anyone else done this? And everyone can laugh at it and say, yeah, I've done it. So they do amazing work. They always do. And it's good to hear about it from actual perinatal and mum's side of things.
If you've not listened to the show, there's various different things that they're doing through either children's centres within the setup of the Feeling Funny setup, or also they're having sessions as well in public. We can go down and take the kids and get involved in different things. Light-hearted focus on that as well. All the details on this week's Mental Health Monday podcast, which you can find out all the latest about that too. I also had a conversation with Izzy Judd. Harry Judd, remember Harry came on the 24-hour show, his partner Izzy, and we shot the breeze on various different things, including advice. We should have a moratorium, is that what they call it, of parenting advice. Look, every time you offer another parent advice, you should say, look, I did this. You should never go, oh, you shouldn't do it like that.
Yeah.
Oh, you're doing it like that. Look, I did this. This worked for us. All parenting advice should start, well, for what it's worth, and then explain what it is.
Yeah, but no one knows what they're doing. Nobody knows what they're doing. It's just later down the line you go, that worked, that didn't work. That's what it's all about. We're going through potty training at the moment, and literally no advice is going to help me at all, because do you know what? My son's going to decide what works for him and what doesn't. We're not just that's not the approach we're taking, is let him. But we'll follow a certain amount of guidance, but he's going to decide ultimately.
So my mum, when we were doing potty training, my mum said to me, well, what we used to do, we used to put a penny in the middle of the potty, and we used to go, there you go, try and hit the penny. I said, Mum, I've got a girl. Why do you say that? There you go. Well, this is what we did. That's always the best advice.
I get a penny.
Thanks to Izzy for coming on the programme as well. Helen and Lauren, who also came on Mental Health Monday as well. Jeremy Corbyn and John Ashworth. It's been a stellar lineup, actually.
What a day.
This week in terms of Mental Health Extra. And Jake Mills was here.
Wow.
Jake's from the Hub of Hope, which you may have heard me mention to Jeremy Corbyn as part of the conversation we had with him. What are you working on at the Jake Mills charity?
Well, we're approaching World Mental Health Day, so we've got a lot going on. I think I can talk about it. Tomorrow we're going to be doing a 1-minute brief, which I've spoke about before. We're going to be working with Thoughtful.com, who are an online card company, to look at creating a mental health related card, which Thoughtful are going to create and sell on World Mental Health Day on the 10th of October. But tomorrow on social media, Twitter and Facebook, there's going to be a 1-minute brief where people are going to come up with their own designs to have that card made. So if you're creative at all, please have a look at that tomorrow.
Jake Mills, thank you for your time. Jake Mills, M-I-L-L.
Doesn't matter now.
Jeremy Corbyn's never heard of him, but he has heard of the Hub of Hope, where you can find mental health services. He actually helped launch the Hub of Hope, so he probably has heard of you. If you want to find out more information about that one, hubofhope.co.uk, type in your postcode or use the location finder on your phone, and it'll find mental health services close to where you live. It's Radio City Talk.
Mental Health Monday with Mick Coyle.
Radio City Talk.